Hello, my name's Chloe and I'm one of the occupational therapists that support the Pulmonary Rehab Service. Today I'm going to be giving you an educational talk on anxiety management. First of all, we need to discuss what anxiety is. So having a long-term condition can affect your lives in a lot of ways. With a respiratory illness, it doesn't only affect you from a physical point of view, leaving you breathless and fatigued, but it can also affect your mood and how you feel. Anxiety is a way of describing the feelings of unease, worry, or maybe fear, but it's a normal response to a situation that we might find threatening to ourselves. These feelings can come and go, or they might be present a lot of the time. They may feel intense and difficult to cope with. You may start becoming irritable, distracted easily, or struggling to sleep. People often mistake anxiety for a physical illness. So therefore, the first way of learning how to manage your symptoms is recognising that anxiety might be a problem for yourself. It might affect the way you feel, nervous, tense, or wound up. It might be the way you think, worrying thoughts, difficulty concentrating, imagining that the worst is going to happen. The way your body works, your heart might be pounding and racing, you're becoming out of breath, or your stomach's churning. The way you behave, you're pacing, you're unable to sit down and relax, you're starting to speak more quickly, or you're avoiding the feared situation. A common sign of anxiety for someone living with a respiratory illness is the feeling of panic or anxiety when you're becoming out of breath. When someone is becoming breathless, it could be an automatic response to begin to panic. You might be thinking that you're unable to breathe, or you're getting embarrassed because you've had to stop and ask for rest. This might lead to your anxiety flaring up, and in turn it can make you feel even more out of breath, and you might have difficulty trying to control this. Therefore, it's important that you recognise if panic or anxiety is something that's triggering your breathlessness. Then we can think of ways of how to better manage this. And this is where anxiety management can come into use. There's a lot of different ways that you can manage your anxiety that is non-medical. Relaxation. So as part of your pulmonary rehab exercise sessions, we've been advising you to complete a short relaxation session at the end. You could use that if you find it useful. There's also guided imagery. So you can try and find a comfortable position to sit in and think about a memory, something that makes you happy. If you then shut your eyes and try and visualise that memory in your head, it can help relax you. You've also got yoga, mindfulness, and maybe a massage that might help you relax. Breathing techniques. So throughout the pulmonary rehab course, we will be teaching you different ways to manage your breathing. In a short while, I'll teach you the benefits of box breathing. Time management. So again, using the energy conservation principles that we've discussed and applying them to your everyday life. Making sure you're nice and organised and planning ahead. Physical fitness and sleep. So engaging in regular exercise, making sure you have a good sleep hygiene, and allowing time for rest. And distraction. So engaging yourself in a hobby, something that you find enjoyable to complete. It might be that you're going to go for a walk, or you might read a book, something that you find beneficial to you. Distraction can help take you away from that feared situation. A breathing technique that you might find useful is box breathing. To complete this exercise, all you need is a rectangle shape in front of you. This could be a TV screen, a photo frame, a road sign, a tissue box. Whether you're indoors or outdoors, there is going to be some form of rectangle shape that you can concentrate on. So to do this, you need to start by taking a sigh out. This will help relax your body and get it ready for the exercise. We then want you to follow the rectangle shape with your eyes. When you're tracing the short edge, we want you to breathe in, and when you're tracing the long edge, breathe out. So short edge, breathe in, long edge, breathe out. You can do this for as long as you feel you need until your breathlessness is more under control. Not only will this help with getting your breathing pattern into the right pace, but it also helps distract you from the feelings of panic when you're becoming out of breath. This is because it's distracting you from the feelings of panic. When you or someone close to you is becoming unwell, it's natural to worry about what is going to happen. Sometimes a worry can be very intense and more like a fear or anxiety. These can be normal reactions to a stressful situation, but it's important that we don't let them get out of hand. Take time to learn about the emotional effects of your condition. It can help you know that the feelings are common amongst others with a similar condition and you're not alone. Have a go at some of the anxiety management techniques that we've discussed, but if you feel like you'd like to discuss this further, please get in touch with one of our pulmonary rehab professionals. You could also speak to your GP. Thank you for listening. If you've got any more questions, your pulmonary rehab professional will be in touch with you this week to discuss further.